Hi, I'm Dr. Ken Muhich from the Fibromyalgia Wellness Center. And after all of the pre-protocol and all the information that we've actually covered, you actually start into the second portion of the treatment for fibromyalgia patients. And that includes something called Guaifenesin. It's very, very important. Fibromyalgia patients that have problems that are so wide and varied, research has shown that they have excess amounts of phosphate and calcium in their cells. And what Guaifenesin does is it pulls the excess phosphate and calcium out of the cells and they evacuate it through their urinary system. Now, the problem is, how much do you take? Well, you start out with 300 milligrams twice a day. And you do not change this unless you have a reaction. What is the reaction? Well, it should be, actually, I'm sorry to say, you feeling worse in certain areas, whether it be an increase in headaches or back pain or neck pain or whatever it might be, or overall pain. This actually shows that the Guaifenesin is actually working. Now, I know that sounds bad. And you've heard the term, you have to feel worse before you get better. But in this case, the Guaifenesin is pulling the excess amount of chemicals out of your body, but not all at one time. Think about it. Your bladder is like a ball. But by the time it gets down to the urinary tract, it's like a straw. So it can't all get out at the same time. That which is actually kept in the body causes the reaction. But as you go along, longer and longer, you'll find that the reactions are less and less, and you have more and more good times, feeling better, improvement as you go along, as the excess amounts of phosphate and calcium actually evacuate out of your system. Most important thing, what is Guaifenesin? Well, Guaifenesin is actually one of the only things that was really active in your cough syrup when you were growing up. All the rest of it was sugar. What it does, it helps break up the cough and congestion and allows you to expectorate it, get rid of it, so to speak. In today's modern day, you may have heard it in the term of Mucinix. Mucinix is Guaifenesin. That's exactly what it is. However, Mucinix is very, very expensive. Not only that, but there are certain things that are produced with the product of Mucinix that are adverse to the fibromyalgia patient itself. These products that we suggest are pure products, not those that have any additives or anything involved with it. And so you will have a much more successful treatment protocol if you follow what we suggest you very, very closely. The next thing we're going to talk about is how much you actually take and when you should actually increase the Guaifenesin. And that's going to be under mapping, and we're going to cover that next. Again, this is Dr. Ken Muhich from the Fibromyalgia Wellness Center, and we're always glad to see you back in other body parts. And again, just to remind you, check our website, fibrowellnesscenter.com, for many other blogs and information concerning fibromyalgia patients. Thank you very much.